we can go ahead and get started. So welcome everyone. Thank you so much for joining us for this quarterly call for the Cutting Edge Learning community. The topic that we're going to be focusing on today is quality improvement. So moving from evaluation to quality improvement. The last 4 of our trainings have really focused on evaluation. And so today we wanted to transition that a bit to really highlight and start to talk about what are some of the different ways that you might use that evaluation data. So thinking about how to improve our programs using the quality improvement. And so I'm joined with my wonderful teammates. Shout out to Linda Krisawati, who's also going to be presenting with me today. And so we'll go ahead and get started. So our agenda for today, there are going to be 2 primary tools, quality improvement tools, that we're going to be teaching and learning and playing with today. So that is the Fishbone Diagram and the 5 whys. So we're going to begin by kind of talking through those, and then we'll move into breakout rooms where we're going to have a sort of facilitated activity where you're going to have the opportunity, if you would like, to volunteer an actual challenge that you're facing in your work to apply to the activity. So just a plug to start thinking about that now if you might want to use your work as the example. And then we're going to come back together and do a bit of a share out and wrap up. And so we'll talk about that. But definitely there's going to be time for interaction, time for engagement, but also this is going to be really a lot of learning, kind of sharing these different tools with you. So our objectives for today, the first one is to increase the understanding of how evaluation data can inform quality improvement efforts. The second is to describe the importance of identifying the root cause of an issue. And then the third is to explain and demonstrate how to use root cause analysis tools. So again, this is our last training was very workshop focused. Today is a little bit more diving in with some tools. It's a little bit more applied focus. So to start, let's just talk about how does this relate to what we've been talking about the past few sessions. So it really relates to process evaluation. So if you remember, there's different types of evaluations. You have process evaluations, which really look at areas of growth and aspects of your practice that might not be working as you intended. So I wanted to see kind of a little pop quiz. Can folks share examples of things that they remember that we discussed for process evaluation in the chat? So what are some examples of a process evaluation? What types of things might you be looking at in a process evaluation? And you can come off mute or chat them in. And I know it's late in the day on a Monday, so if you need some hints, I can definitely share some answers. So some of the things that we might think about for a process evaluation are, I see someone chatted in, who chatted this in? I think Nick just chatted in, percent of training participants who feel the training was worthwhile. So that's definitely an outcome that could be a part of a process evaluation. It also can be things just like, are you hitting your targets in terms of the number of folks that you're hoping to train? Are folks participating in your activities in the ways that you intended? Are you promoting? Are you hitting your promotional targets? So they're really things that might center on the implementation of how your program is being implemented currently. And so looking at our process evaluation data, you might identify a challenge or a problem, something that isn't working as you intended. And so what do you do from that, right? You've done all this work, you've gathered this evaluation data, but how do you translate that into change? And so that's really the process that we're going to be talking about today, what you do once you identify a problem. So the things that you're going to really need to do are to think about the root cause of that issue and how do you figure out what that root cause. And so we're going to present some of these different systems thinking tools that can help support that for you. But first, I know I've been throwing around this term quality improvement, but in case folks aren't familiar with that term, quality improvement is really a framework used to systematically improve care. And what it really does is there's a variety of different approaches that exist to help you collect and analyze data and then test changes incrementally as a way to sort of standardize your processes and reduce variability to really figure out, are you addressing the root cause of the challenge or the problem at hand? And there are some basic components of quality improvement, which we'll cover, and we'll cover further in like subsequent trainings as well. But the first is really establish a culture of quality in your practice. So that's kind of establishing a set of standards and baselines that folks are expected to reach, to determine and prioritize areas for improvement, to collect and analyze data, to communicate your results of that data, to commit to ongoing evaluation, and to spread your successes through lessons learned and sharing out lessons learned. So that's a very brief overview. Essentially, quality improvement is a variety of different frameworks and approaches, all geared towards this idea of improving your work. And so with that, I'm going to hand it over to my colleague, Linda, to talk about the first tool that we're going to be deep diving today.
Thanks, Laura. And with that, I'm going to ask you to move to the next slide, please. Thank you. So we're going to chat a little bit about that fishbone diagram, but first, like Laura said, really just wanting to dive into how quality improvement endeavors can really help us identify and address problems or challenges with our program implementation or service delivery. And I think, you know, as our brains work naturally, like as soon as we identify a problem, our brain is like already 3 steps ahead, and we're starting to generate possible ways we can address those problems. But how often do we actually give ourselves the time to like sit, reflect, dig into the problem before we start to actually solve it? So each problem that we identify through our quality improvement process is really an opportunity for us to better understand what's causing it to occur in the first place. So if we continue to generate solutions based on what the problem appears to be on the surface, we're most likely going to continue to run into that same challenge like over and over and over again. So really spending the time to go deep on a problem to truly understand what's driving it will lead to generating a solution that ensures that that problem isn't going to continue to return in the long run, right? So those are just some of the key messages that you see highlighted here on the screen. So next slide, please. So in thinking about root causes, there's a particular tool that Laura mentioned that we can use. So this is the fishbone diagram. So it's just one of many quality improvement tools that can help you once you've identified a particular challenge or issue through those quality improvement processes. So it's actually a visual way that helps you think about and then map out a problem, as well as the possible causes or factors that lead to or contribute to it. So just a few things that I wanted to, underscore about this tool and how it can be helpful. So the first thing is that it helps you to focus on the causes of an issue rather than just focusing on the symptoms, right? Which is what you can see on the surface. It helps us to dive a little bit deeper. It also allows us to see all of the potential or possible causes of an issue at one time, right? So we're not just looking at one here and one here. We can see all of them together in one diagram. The other thing too is that it can provide a very structured way to brainstorm, right? We all know that brainstorming can sometimes be a little complicated, a little gray, a little vague. So this provides a really nice structure for helping us get out our ideas and then having subsequent conversations based on the ideas that we're generating. The other thing too that's really nice about the fishbone diagram is that it's kind of has a collective focus, right, for identifying and addressing root causes. So it brings together diverse perspectives of folks working on a particular issue, and essentially, you know, you're working as a team to identify what these root causes are and how you might address them. So kind of going through some root consensus as well. So it's just really nice to bring together these different ideas and opinions in one diagram. And then the last thing that I would offer is that the fishbone diagram can be really helpful for supporting your team to prioritize a relevant cause of an issue, right? So through this diagram, you might identify 5 or 6 or more causes of an issue. So how do you determine your next steps? So the fishbone can help you kind of drill down on that and figure out, well, how do we prioritize which one to focus with first? So that's just a high-level overview of the fishbone diagram. Next slide, please. I just wanted to stop really quickly. It seems like there's a little bit of feedback. I'm not sure if everyone is muted. There's just like a little whooshing sound. Thank you. So what you see here on your screen is an example of the fishbone diagram, right? This is actually what the model looks like. So I did want to point out that there are several different models for fishbone diagrams. And a lot of these, if you kind of look at them a little bit more closely, you look at the language, a lot of them come from like tech and industry. So some of the terms or language they use might not resonate with public health per se, but just wanted to offer that it's okay. It's more about the process and that we have the opportunity to modify some of this language to be more pertinent to our specific public health needs. So to kind of walk you through this framework, if you start all the way on the right-hand side, we start by identifying what's the key problem we'd like to address. So this might be something, sorry, you might see my cat. She might be joining us as your bonus facilitator. This is, maybe like it's a recurring issue that's continued to bubble up during the implementation of your particular practice or program. It might be a key piece of feedback that you've continued to receive from people who are participating in your services. But whatever that particular problem or challenge is, we want to frame this as a statement. And this is what you place at the head of the fish or the diagram in that box that's on the right-hand side of the screen. So from there, sorry, I'm going to move the cat. From there, oops. Sorry about that. From there, we then use this, information or feedback that we've collected during that quality improvement process to determine what are the four main kind of overarching categories or themes of causes that we think are contributing to the problem that we've identified. So depending on the fishbone model that you're using, like I said, sometimes the language may differ a little bit. She's very persistent. Sorry. But ultimately, it doesn't really matter what the title of those categories are. It's all about you getting your ideas out on the diagram. So use whatever terms or categories make the most sense for your particular challenge or problem that you're focused on. So what you see here, one of the most common kind of groupings of terms or themes that people might use around those key causes. These are what we call like the 4 Ps. So procedures, policies, plant or technology. This is again where you can see a lot of this is stemming from like industry or like tech fields. And then the 4th P is for people. Another way that we can kind of think about these overarching themes or some terminology you might see are the 4 Ms. So this would be like methods, which refers to, sorry, a cat's touching the keyboard, policies and procedures. We have our materials. We have machines, which again, thinking about public health, this could be like transportation, having access to like, technology like cell phones or computers or, things along those lines. And then the 4th one is man or people. And this is really thinking about any causes that are related to the people who are involved in relation to that particular problem or challenge. So again, I know the terminology may not always resonate with us in public health, but the purpose of this is to really think about what are kind of the overarching categories or buckets of causes that are contributing to that problem, and what's the best term for us to use to label it so that we can walk through this exercise. So the next step after you've identified your key causes, sorry, if we can go back one slide, please, thank you. After you've identified or labeled those key causes, you would then draw lines from each of those causes back to your problem statement. And then once you have that diagram constructed, you can actually start to think about, again, any pieces of data or information that you've collected prior to this on those potential causes of the problem, and you would then write those on each of these lines that then feed into that larger category or theme of the causes. So again, this is just kind of high-level template of what the fishbone diagram looks like. Next slide, please. So here's an example. We're not going to walk through this one in any detail, but just wanted to show you, like, once it's populated, what this can look like. So you can see that they've listed the problem statement over here on the right-hand side. So in this particular case, their challenge or problem that they're hoping to address, and better understand the root causes of is approval of applications is taking on average 63 days. So we don't necessarily have all the context to understand this problem statement within, but we can probably infer that 63 days is a very long time for someone's application to be approved. So they're looking to figure out how can they expedite that particular process. So to address that, they then identified, what are those four main categories, or factors that are feeding into or contributing to this prolonged application period. So this is where they then thought about machines, materials, methods, and man or people power. And so here on your screen, if you look at each of these categories, you can then see how they thought about under each one of these, again, overarching kind of groups of causes, what were the specific things that they thought were driving this? And again, it's a conversation. It's not one person filling this out. It's a group, a team working together to identify what they think the main drivers are of each of these larger categories, and having that conversation. So you can see here, they're pretty evenly matched between the four different categories where they were able to identify some different contributing factors. And so after this, they would then have subsequent conversations to figure out which area or which kind of group do they really want to drill down on to better understand what's leading to this and where they can actually intervene within the system. Next slide, please. Okay, so this is the example we're actually going to walk through because this one is very public health focused. And so here I want you to imagine we have a hypothetical organization, and they provide programs or services for children and youth with special healthcare needs. So to better understand how they can strengthen the services that they're offering, they conducted focus groups within their communities, with parents, with providers, maybe with some of these children themselves. And from all of this information, they identified that there were 5 areas that they needed to improve in relation to the programs or services that they were offering. So they identified care coordination, education for parents, creating awareness, access to services, and screening as the 5 areas that they could do the most improvement within. So then after this, they went through kind of a prioritization exercise where they then identified that care coordination was the area of improvement that they wanted to focus on first. So then to better understand, okay, if care coordination is the issue where we need to make some pretty substantive, changes or improvements, what's driving care coordination to not be as strong as it could be? So here you can see how they use the Fishbone diagram to essentially organize all of the potential causes that were contributing to that lack of coordination. And so like I had mentioned, on the previous slide, it's okay to relabel the different categories or terms depending on what makes the most sense for you. So in this particular case, our organization decided to use those 4 M's, or decided not to use the 4 M's rather, and decided to use the 4 P's. So for each of these 4 kind of overarching categories or groupings of causes, they used the data they had, they used the information they had to think about what's driving this? What are the potential causes? So for example, you can see, for technology or setting, they identified a few things that were kind of contributing to this particular piece. And so they thought maybe it was the location of the facilities, maybe there was an issue with the referral tracking system, and then maybe there was also, some potential challenges with the electronic monitoring, record communication. So once they went through this process of, outlining the different causes, they then looked to see which of these 4 areas that they had identified would have the biggest impact on on the challenge or the problem statement that they had listed. So within this example, they decided to then look within the people category and specifically at the schools are unaware of the care plans. They felt like this might be the best place for them to start, and they started to dig into this and think a little bit more concretely around why does this exist? Why are schools unaware of the care plans? And so some of the things that they identified was that, why they're unaware of the care plans is that maybe the provider's office doesn't alert their school nurse that they have a care plan in the first place. Maybe the provider's office is not aware that the child has a school nurse within his school. Another possible cause is that maybe the paperwork at the provider's office doesn't ask if the school or the child has a school nurse. So again, you can see kind of through this line of questioning and starting to get a little bit deeper and deeper and deeper in terms of the causes, we've started to unearth some very specific, tangible actions that this group could potentially prioritize and then address. So again, the fishbone is just a really helpful way to kind of articulate and get everyone's perspectives and ideas and all the information you've already gleaned in one place to then make some informed decisions about where do we go deeper? Where do we maybe need some more information? What do we prioritize in terms of addressing our challenge? Next slide, please. And so here on this slide, you can see this is just an example of how you can do the fishbone on a flip chart with sticky notes. So, back in the day, in-person meetings, this was one of the ways that fishbone can be done. So it's something that you can still do. This is also something you could easily transfer or translate into Jamboard. There are also a number of different, templates that exist in PDF. It's also a simple enough template where you could just freehand this on a large piece of paper. So just wanted to offer that this is a really user-friendly tool that you can use in a number of different mediums. Next slide, please. Okay. And Laura, if you don't mind, just could you put all of the steps out at once? Thank you. So what I want to do now is essentially just kind of recap the steps for creating and then using that fishbone diagram. So the first thing is to always identify your problem. So again, this is where your quality improvement process, any sort of feedback mechanisms you have can be really helpful. So identifying what is it that you want to focus on or address, and you put that kind of at the head of your fish, right, in that box on the right-hand side. From there, you would have a conversation with your team. Again, you can use any information you've already collected to determine what are the major categories of causes that are contributing to this particular challenge. So we talked about, some different buckets that you can think about. But again, a lot of these, maybe they don't resonate with your project. You can change those. You can even add more categories or more buckets depending on how what you think is actually driving your particular challenge. So again, you have a lot of flexibility with this part of it. After you've identified kind of those major categories, you would then think about, well, what are the actual factors or causes that are contributing to this? And again, this is where you can use data information that you've collected previously, having conversations with your team, right? Doing this as a group. But the idea is that you're kind of brainstorming collectively to discuss and dialogue with one another. What do we think is contributing to this? From there, in terms of thinking about, where do we go now that we've diagrammed all of this, think about what we refer to as like the balance of the diagram. Are there any kind of buckets where maybe you have fewer causes you've identified than others? That might be an opportunity for you to go back and maybe collect some more information, because if you can only think of maybe one or two causes that are contributing to that category, you might need to do some further digging, right? You might not be going deep enough, or maybe you just don't have that information. On the other hand, is there one where you feel like there's a lot of factors that are contributing to it? That might indicate that this is a particular area where there are a lot of different things you could do to address this particular challenge. But essentially use the diagram to then determine, sorry, thought we were so close, but the cat decided to jump on the keyboard. To then determine, which category do we want to start focusing on, right, in terms of addressing our particular challenge. So this can be used to then prioritize. And then think about, where do you feel like you have the most leverage to make a change? And so from there, we can then feed this into the 5 whys that Laura's going to talk about next to help us continue to drill down to identify that root cause. And then after that, we would identify, potential solutions for addressing each prioritized factor. And then we can test using our PDSA cycles, which I'll talk about on the next slide. So just wanted to recognize that many of you might be familiar with PDSA cycles. So in the chat, I just wanted to see if you could share if you've used a PDSA cycle before and how you might have used this. So again, just if you have used PDSA cycles before, if you want to put that in the chat, I'm just curious to see how familiar everyone is with these. Okay, Robbie, thank you, is saying yes, we have used them. I was going to say, I know especially in Title V, PDSA cycles are very popular, so chances are some folks have used them or at least heard of them. So thank you for sharing that. So really what PDSA cycles are, stands for Plan, Do, Study, Act. So it's really a process for quality improvement that helps you to identify what you want to change and then create a plan to test it on a small scale, implement that change, study what happened, what worked or what didn't work, and then kind of feed it back into another cycle of making another subsequent change, studying what happened, reflecting on it, making some changes, etc. So it's really helpful because it allows us to make changes on a very small scale, so that the impact of making a change that doesn't work so well is not necessarily going to have a very large negative impact. So again, I think this is something that we're probably going to pick up with at a later date, so we can certainly dive into this in a little bit more detail. But just wanted to share that this is a really helpful tool that some of you might be familiar with as well. So with that, I'm going to now turn it over to Laura, who's going to walk us through the 5 Whys tool, which is going to help us further identify like root causes that we started to unearth within our fishbone diagram.
Thanks, Linda and Pavlova. Thank you both for that wonderful presentation. Pavlova is her cat, in case folks are wondering. So yes, with that, we're going to talk about the 5 Whys. So what the 5 Whys are and how they relate to the fishbone diagram. So what is it? The 5 Whys are really a very simple, effective tool for uncovering the root of a problem. It's truly a question asking method, and it can be used really quickly to determine the root cause of a problem. So it often comes in handy during troubleshooting, problem solving, and quality improvement initiatives. So you can kind of see this little image of the screen on the screen here of the 5 Whys going down. And so essentially we're going to walk through in just a moment how to actually use this tool and some examples to help you see how this then relates and connects with the fishbone. So it's a very simple tool, whereas the fishbone, there was some different titles of those different categories, which can at times feel confusing. The 5 Whys, one of the best things about it is its simplicity. And the fact that it really removes all layers of assumptions. So by forcing you to articulate exactly why a problem is occurring, you kind of break down those assumption layers and get to that root cause, as I keep saying. So how to actually use it. So first, similar to the 5 Whys, you write down your problem and you're wanting to be very specific. And then you just ask yourself, why did that problem happen? And write down that answer. And then for that answer, ask, why did that happen? And you keep going in this way until you get to that root cause where you're like, okay, this is why this overall issue occurred. A tip for sort of checking to see if you're doing it correctly is by working backwards and using the phrase therefore, as I'm going to show you in just a minute here. So in our example that I'm going to share right here, we have our problem, which is that I am starved at 10 a.m. and I can't find anything to eat. So if we're doing our 5 Whys, and I would ask, okay, well, why did that happen? First why might be, well, I didn't eat any breakfast. Well, why did that happen? I didn't have time to fix anything. And why was that? There's nothing to eat and there's nothing easy and quick in the house to eat. And why is that? Because I did not buy breakfast bars or yogurt. And why is that? Because these items were not on our shopping list. So you can see how we've moved from, oh, I'm hungry because I didn't eat breakfast, to getting to the root of why that happened, which was you didn't have any breakfast food in the house because it wasn't on your shopping list. So that becomes your root cause. That's your actionable item that you can then address. So in our real world situation, you might then implement a PDSA cycle to test that root cause to see, was this in fact the root cause? If we address this challenge, will that then fix the overall problems that we're having? And so just to illustrate the therefore logic, so if you want to test your logic and think, am I doing this correctly? What you can do is start at the bottom with your root cause and then say therefore. So you could say, the items were not on the shopping list. Therefore, I did not buy breakfast bars or yogurt. Therefore, there was nothing quick or easy to eat in the house. Therefore, I didn't have time to fix anything. Therefore, I didn't eat breakfast, and because of that, I'm hungry. So you can see how it kind of works in the opposite way if you are just wanting to check your logic. Obviously, this is a very simplistic example. It can get more complicated with your actual work example, so this kind of therefore check can be a useful tool. So now let's talk about how does the 5 whys map onto the fishbone. So we're back at our example from before, looking at the applications and the time that it takes for an application to be approved. So let's say we've done this fishbone diagram, we've done our prioritizing, and we actually decide that this manpower category is where we're going to focus our attention. So in talking through the different options under the manpower category, we decide that we want to focus on the limited capacity of consultants to process all applications. So that's our problem statement. There's a limited capacity of consultants to process all applications. Why is that? So let's do our 5 whys. Why is there limited time? So it might be because there's about 100 applications for one consultant at a given time. Well, why is that? Because most agencies send their applications at the last minute. And why do they do that? Because the applications are mistakenly thrown away. And why is that? Because the agencies don't realize that the application is an important document. And why is that? Because there's no indication of important marked on the envelope. So, this last piece here, this is our root cause. So we've identified that this is what we're thinking is the reason that there's limited capacity of consultants. And if we address this root cause, then the other factors kind of on our chain, on our process here are also going to be improved. And so this example probably was pre-COVID times. Now that we're digital, a lot of our work, there might not be this mailing envelope situation, but the same principle kind of aligns here. So this is what you might do is think about, okay, we're gonna do a quality improvement method. We're going to, or a quality improvement approach to make a change so that all applications are marked with important on those documents. And then from there, you could test and see and implement a PDSA cycle to really see, does this impact, how does this impact the full results? So with that was a lot of talking. We're gonna shift into a breakout room activity, but before I do that, are there any questions on the 2 tools that we presented? All right, hearing none, we're gonna go ahead. So what we're gonna do in our breakout rooms is in a moment here, Brittany's gonna put us into breakout rooms and we're gonna ask for a volunteer to share a challenge or area for improvement of their project. What you're gonna do is using our Jamboard template that we've created, you're gonna create a problem statement for your fishbone diagram. You're gonna go through and write out those different causes. And then you're actually going to get to use the 5 whys to drill down the root cause of one of the causes that you've identified. And then we're going to come back together and report out in about, let's say at 5 o'clock, we'll come back together and report out. So that's in 25 minutes. Any questions before we get started? Or if not, Brittany, you can go ahead and open up the rooms. And I will also chat in the Jamboard link.